The viruses that we're targeting with these cell therapies are very common. Most people have them and they don't cause us any problems.
But when your immune system gets severely compromised, either through genetic reasons or in transplant patients, these viruses can lead to very, very serious complications and ultimately leading to death as well. It's very difficult to treat these viruses once they get out of control.
It was just riddled with adenovirus and we just couldn't get on top of it. And it just got worse and worse and worse.
He was so sick. At that time, we told the family there's less than 10% chance of survival.
When you look at those statistics, it's just not great.
The only hope of cure was trying to get these virus-specific T cells.
Immune cells in our body fight these viruses when we are healthy and routinely. So what we have done is we've been able to pull those immune cells from healthy volunteers and bank those cells and then use those cells to treat these patients. We actually manufacture the cell therapies in our dedicated GMP facility, and then we can actually store these as a bank, and when there's a requirement from the patient for the access to these cells, we can find the appropriate cells and ship it to the clinic.
When we receive a request through the Special Access Scheme from a hospital, we drop everything. We move them through as quickly as possible because we know those patients are really unwell. They only come to us when the patients have no other options.
It took us about 2 weeks to get the cells here.
And they gave him the syringe and then they watched. And I was waiting and they said, oh, it's done.
Kobe, general condition improved drastically. He had no more pain. He was able to eat and he was able to mobilize.
He was just almost a different kid. And then 2 weeks they were talking about discharge.
Seeing how he'd turn around and even just following his bloods after he got the infusion of cells and suddenly seeing things start to turn in the right direction, it was miraculous.
I was amazed. I mean, it was unbelievable.
It was just done. It was just fixed. It was just gone.
I don't really remember much of the experience. I just remember when it was all over. I feel a lot stronger and stuff because I never used to be able to do sports or anything like that. But now I can beat some of my friends and stuff.
You do this research to do a better outcome for the patient, and this is one of the best examples. It's a multi-pronged strategy that the Institute has built over those 2 decades, and it's wonderful to see this outcome at the other end. The Nature Communication paper shows for the first time that if you offer these cellular therapies to critically ill patients, 65% of these patients show a clinical improvement or a complete resolution of their disease.
I don't think I've seen a treatment have such a profound impact on a virus before. About a year after those therapies were all completed, patient back at work, almost off all medications with a functioning graft, and those viruses are really a distant, horrible memory.
There's a real need for these therapies, and we've seen a real increase in the applications to access these therapies in recent years.
We are actually receiving anywhere up to 3 to 4 requests per week, and that's getting very difficult. It would be wonderful if we can have funding to establish a national bank which overtakes all this process of special access scheme. Once that bank is made, we would like to use that bank to run what we call randomized clinical studies. It's a long-term dream is to have these drugs approved in Australia so the patients don't have to come through this compassionate access system.
It'd just be life-changing, absolutely life-changing. We feel a bit privileged that we had access to this option.
In the era where we didn't have this particular therapy, we lose these children. And the cost of this therapy is so relatively cheap compared to cost of hospitalization.
From an economics point of view, it actually just makes sense.
I can't see why there shouldn't be a national scheme. You have something which is difficult to produce, requires a skilled lab, requires production facility, requires all the quality parameters. It makes sense for it to be made in one lab, but for a streamlined process for application, approval and transport, it's a bit of a no-brainer.